People with Parkinson have a very interesting way of associating to sexual dysfunction. Because they have all the motor and the non-motor symptoms, each of them can affect men and women. In some areas, they affect them similarly. For example, like changes in desire, which is lower. And in some areas, men are more affected, for example, in satisfaction, where we see that many times women are more satisfied than men. Now, how does it affect? If we just think about the motor symptoms, let's imagine movement. You know that part of sex is touching and being aroused and excited. Now, if you have tremor or stiffness, of course you have some disability and your arousal is not effective. So it can affect men and women. Then let's think of movement, of a position, of concentration in a special position long enough to reach a level of excitement that can bring you to orgasm. So each part of these symptoms can affect men and women. But since men are more affected by motor symptoms of Parkinson, because many men take the role of being more active, of being in a position which is called men on top positions. And for them, sometimes it is difficult to move from a side position. Let's say that a couple is lying aside and one is touching the other, and then he wants to move to the on top position, and he may lose the concentration. Consequently, he will lose the erection. And that's the reason why we see that men may have more desire, but they are less satisfied because their motor function does not allow them to perform as they used to. For women, many times if they have the ability to be caressed, to be touched, to be in intimate relationship or activity with the partner, they are very satisfied. So in a comic way, we see that sometimes women have lower desire but higher satisfaction. And men may have higher desire but very low satisfaction. So the effect is really various, and usually we have to study it. This is a great question, because if we think about sexuality, sexuality is not only having sex with the genitals. Sexuality has a physical aspect of touching. The touching can be non-erotic, like hugging, kissing. It can be erotic touching. Sexuality has also emotional part, like loving, caring, paying attention, liking. Also, it has an erotic part of being sexually excited, attracted to one another. So if we think about sexuality, it means that people who are sexually active are also intimately active. And they have the chance to be touched, to be loved. That's why we see in many researches now, the research was done on various patients, and we see that massage, just touching, genital stimulation, we see that all these create an increase in oxytocin and endorphin. And these two neurotransmitters, usually what they do is they reduce tension, they reduce anxiety, they reduce pain. And we have today studies showing these effects on women who are going chemotherapy because of breast cancer, on people with chronic migraine, on women with menopausal symptoms, on older people with dementia. So we see all these a positive effect on your health. And the problem is that when people stop having sex, they stop hugging, they stop touching. Yeah, actually, when physicians hear my talk about sexual dysfunction, they think, what can I do? I don't have time. I see a patient and I have to deal with so many problems, but I want to tell each physician, and not only physician, maybe other health professionals hear this talk. I would like to tell everyone that in 2 minutes, 2-3 minutes, you can really help patients. First, the first thing, which is very important, is just letting them know that there is a problem and giving them permission to talk about it. Because nobody lets us talk about our sexual problem. So, for example, if a patient comes to you as a physician and you ask him about problems with sleep, problems with talking, problems with swallowing, problems with urinary system, problems with constipation, problems with movement, just ask one question. And what about sexual life? Is there any, because people with Parkinson have many times problems in their intimate and sexual life. The moment you ask this question, you gave your patient such a huge help, because usually what they think, wow, I am such a useless person. I have Parkinson, I can't drive, I can't work, and now I can't have sex. So at least they know that this is part of this deal that they received, not a very good one, but this is part of this issue. So the first thing is just raising it. This is the first intervention that you can make. The second one is saying, look, I can send you to an expert, for example, a urologist, which can help men, a gynecologist, which sometimes can help a woman, but at least you can tell them, we can think about what we can do about it. And the third thing that you can do, as a neurologist, you can check if there is a good stability and treatment to many motor and non-motor symptoms. Maybe the patient has to be better balanced. So these are the 3 things that you can do, and if you do them, you just did a great job. Actually, all of them. Let's take the psychological ones. Anxiety, depression, fatigue, apathy, lack of motivation. Each of them reduce your ability to initiate any activity, including intimate activity, physical activity, touching, hugging, sexual activity. The antidepressants which we give to treat anxiety and depression sometimes causes the sexual response to become slower, and some patients will lose the ability to reach orgasm. So this is one aspect. Then we have sleep disorders. Now, if we have sleep disorders, many times couples with Parkinson separate beds or separate rooms, because sleep is very important, so this is logical. So as you see, the non-motor symptoms are really a big, big issue. I have a very important advice for the patients, okay? And the advice is, if you have a sexual problem, talk to your doctor. If you feel that your doctor is uncomfortable with talking about sex, which can happen sometimes, then find someone among the health professionals. Sometimes it can be the nurse, it can be the psychologist, it can be the psychiatrist, it can be the social worker, whoever is in your team which deals with Parkinson's disease. And tell them, I have a sexual problem. with whom can I talk about it? If you are a man, go to your urologist and check with him, because sometimes urologists will solve your problem. If you are a woman, and you might have, for example, problems with your lubrication, so sometimes the physician might advise you about a good lubricant, or sometimes your gynecologist may advise you to take local or systematic hormonal replacement therapy. So check with these physicians, and what I'm saying, don't give up. My advice to caregivers is that you as caregiver need a lot of touching. You are working a lot, you take care of a lot of roles to help your partner, sometimes washing the partner, sometimes changing diapers, sometimes helping with eating and helping with sleeping and helping with walking and traveling, and you need also to be treated. So ask your partner to touch you, not sexually even. You are tired. Foot massage is very good for a tired person. Back massage. And if your partner is incapable of this, or if your relationship is not that good, maybe you go to couple therapists, but for your touch, go and have a good massage. Don't give up. You need the relaxation as well, because if your partner has Parkinson, you also have Parkinson in another way. For the physician, I would say, don't hesitate and imagine that sexuality and intimacy are a very important issue. So if you want to talk to your patient, use a sentence which is accepted usually very well. And you can tell your patient, you know, people with Parkinson usually will have sexual problems. And if you will have any problem, just tell me. And my advice to you, that you don't have to give an answer. I know that as a physician, you are trained always to give a treatment or prescription or advice, but not in this case. In this case, it's enough that you listen to the sexual problem and you tell your patient, look, I will think about it, or I will refer you to an expert. But I would say you can do one thing more. Check various motor and non-motor symptoms and see if you can give any advice to your patient. And ask them if this symptom interfere with the sexual life. Actually, you can tell also your patient that in the internet there are many answers to many questions. And actually, if your patient will write Gila Bronner, they will find many interviews and many articles which might help them with practical advice.